Taoiseach, last week I spoke with the mother of a long COVID sufferer who, up until she contracted the virus, was a young, fit woman working as a doctor in a busy hospital. She has not stood on a hospital ward in over 11 months because she is still recovering from the illness. Based on research conducted both in Ireland and the Netherlands, there are 336,451 adults who are experiencing or have experienced a long-lasting impact of this illness known as long COVID. Long COVID encompasses a broad range of illness following COVID infection and is based around 3 clusters of symptoms: 1 fatigue, 2 respiratory issues and 3 cognitive problems. These can range in severity from those who can't recall the PIN number for their bank card to people who are unable to get out of bed. The vast majority of these people did not require hospitalisation at the time of the original infection, with many experiencing only mild symptoms. Now, the HSE has recognised the need to support these patients, and last September it finalised an interim model of care for long COVID to provide a national approach to the provision of services and supports. Yet up to last month, just 20 of the 60 health service staff to be recruited to these regional centres for the management of prolonged conditions associated with COVID-19 were in post. We're told that until these regional centres are fully operational, we won't see the establishment of GP referral pathways. And even now, there is still no plans to provide a dedicated service for children with long COVID. These 8 planned regional clinics will primarily focus on fatigue and respiratory-related issues, with a single consultant neurologist appointed to deal with cognitive problems, despite evidence presented to the Oireachtas Health Committee indicating that cognitive and neurological problems are emerging as the most significant long-term issues for those with long COVID. In fact, the only clinic supporting those with long COVID neurological issues at the Mater Hospital is set to close its doors at the end of next week because of the failure by the HSE to fund it. Taoiseach, I firmly believe that the failure by the HSE to put a comprehensive strategy in place for those with long COVID is contributing to the record figures we witnessed last month, with almost 10,000 patients on trolleys in our hospital. Unless we revise the interim model of care to reflect the emerging evidence on long COVID and then deliver on such a strategy for all our patients, regardless of age, regardless of illness, this will compound an already dire prognosis for our health service this winter.
A very important issue which is affecting quite a number of people, and I've tremendous sympathy for those suffering from long COVID. It's one of the reasons, by the way, during the height of COVID, when we had to lock down, that I was insistent on taking strong measures. It wasn't just about mortality, it was that this was a deadly disease, and that when you got COVID, it could lead to long COVID, and it could affect a person's health and quality of life for quite a long time after getting COVID. And that was warned during the pandemic, but people were saying, oh, we can get by and all of that. This was a disease that we had to try and avoid people getting, at least until vaccination arrived, because vaccination has prevented the disease from impacting more severely on people than was the case prior to people becoming vaccinated. To me, vaccination was the game changer. That said, there is an interim model of care, as you have described, to provide long COVID services nationally. We do want to see a more uniform framework. There is a lot of research going on. And in the nature of medical research, we will need more research, not just in terms of identifying the features of long COVID, or indeed the duration of long COVID, you know, the length of time it will impact on a person. Presumably, the research will also have to look at the model of care, because say you develop cardiac issues, say you develop respiratory issues, and we have a long COVID centre in a hospital. Ideally, the respiratory specialists in a centre of excellence for respiratory issues should then perhaps have to deal with the person's issues. So will at some stage need an integrated multidisciplinary approach to some of the issues that manifest themselves as a result of long COVID. And I will follow up on the matter issue, because you're correct on the cognitive and the neurological implications of long COVID, and that's not disputed. At least I don't believe it's disputed, and we'll follow up on that. There are, as you said, there's about just the long COVID clinics. You have Vincent's, you have Beaumont, University Hospital Galway, I think CUH. You have post-acute COVID clinics in Galway and Connolly Hospital in Blanchardstown. Tala University and James are operating a combined post-acute and long COVID. There's a tertiary neurodegenerative clinic, neurocognitive clinic, in St James's Hospital, led by a consultant neurologist with a background in neurocognitive disorders, which is accepting referrals from long COVID clinics around the country. So we're happy, Deputy, to work with the Oireachtas on this and with the Health Committee. I don't dispute the issues that you are raising. They're very serious issues. In the forthcoming health budget, we would like to see, can we increase the level of resources available specifically in a ring-fenced way to long COVID. About 2.2 million has been allocated so far. And then an epidemiological survey is being planned that will provide insight into the prevalence of long COVID in the Irish population.
Deputy Taoiseach. Taoiseach, on the prevalence of long COVID, based on my analysis of the social welfare payments for COVID-related illnesses lasting 12 weeks or more following the initial infection, we're looking at some 21,000 people in Ireland who are unable to go to work due to long COVID. This figure does not take into account the tens of thousands who are suffering with less severe forms of long COVID, who are going to work, but not contributing to the same extent that they did prior to the illness. Nor does it take into account the thousands of people who recovered from the initial infection, but had a subsequent relapse. Not only is this having a significant impact on our labour force, but as an Australian long COVID study put it, even low rates of COVID-related permanent illness or disability could still lead to very significant future burden of disease. Taoiseach, we need to act now, and we need to act in a comprehensive way.
Thank you, Deputy Taoiseach.
I agree, and I'm not disagreeing with you at all. I would say to you that there are clinics operating, by the way, at HEC sites that were operational before the model of care was rolled out, and the intention is to align all of them towards the national service. It's intended that the interim model of care would be expanded to put in place 8 post-acute COVID clinics and 6 long COVID clinics within hospital groups nationwide. Additional aspects of the service have been delivered, including supports within the GP and community settings and online supports. And as I said earlier, an epidemiological survey is planned that will provide insight into the prevalence of long COVID in the Irish population. And again, the HSE is putting together the metrics, including waiting lists, numbers of patients treated, number of clinics operating, to fully understand the extent of the need. And the HSE has also recently commissioned a HEQA review to further inform the development of the service. In relation to children, just the incidence of long COVID in children, I'm told, is rare and of short duration. But that's something we have to keep a very watchful brief on. And at present, for children and young people suspected of having long COVID,